former president, Dr. UC Garg, who has been instrumental in organizing these programs for such a long time. And we are always patronized by our other EC members, especially Dr. Sunil Mittal, who is the president of IABP, then Dr. Avinoy D'Souza, Dr. Pramod Kumar, Dr. Aleem Siddiqui. Then we have Dr. Nishant Goel as well, who is our treasurer, and Sagar Karya, who is assistant treasurer, and Manishri Gupta, who is our assistant general secretary, and other EC members, and above all our people who have joined us today and who have been always encouraging us to hold such programs. So today's topic is very, very important, the neurodevelopmental challenge in adopted children, which seems to be a recent trend as far as particularly India is concerned about adoption of children, and concerns that will be dealt in detail by our very renowned speaker from Bengaluru, Dr. Ghosh. She will be introduced properly by our chairpersons, and it's my proud pleasure to welcome all the faculty who are on board. I can see Dr. Jyoti Shetty also has joined, and other senior colleagues. Um, we have two very, I would say, celebrity chairpersons, particularly from Mumbai. Once it comes to Mumbai, it is literally synonymous with celebrity psychiatrists. And we have Dr. Kersi Chavda, who is a past president of Bombay Psychiatric Society. He is a consultant at PD Hinduja National Healthcare and Sir H.N. Reliance Foundation Hospitals. He has been chairperson of the Task Force of Indian Psychiatric Society, specifically dealing with the school psychiatry and counseling. He has been panel member of various committees of IPS, and he has been chairing the committees as well. And most importantly, he was the chairperson of Task Force of IPS, which dealt with the LGBTQ community. And he's panel member of also of clinical laying down clinical guidelines for treatment of autistic spectrum disorder. That's why you can see him being a special person today on a special topic. And he has been part of group of Indian Association of Private Psychiatry that dealt with the college psychiatry. Currently, he is advisor of the IPS subcommittee dealing with mass media. In addition, he has been working with kids for more than 35 years and has been the part of first panel of Maharashtra government that laid down concessions for learning disabilities in Mumbai. And he has written chapters in 4 big books 2 years ago and was awarded the prestigious S.N. Lulla Oration. I can keep on going, but time does not permit me to do so. And the second chairperson is Dr. Ruksheda Syeda, who is vice president of IABP, and she actually wears many feathers, they say, in her cap. And she is a multi-talented, multi-dimensional person. She is president of Bombay Psychiatric Society, and most importantly, both the chairpersons are dear friends. So without wasting time, I would hand it over to Dr. Chavda sir and Dr. Ruksheda to take it forward, introduce the speaker and the topic, and Dr. Junaid Nabi to be in the background so that he can moderate during the discussion and also give the vote of thanks. Dr. Ruksheda, Dr. Chavda, please go ahead.
Thank you, Dr.
Me first, Ruksheda?
Yes, sir, always.
Thank you.
No, nothing great about it. Just age before beauty, you see.
Neurodevelopmental disorders associated with womanly delusional disorders. Okay, anyway. Just a small correction. I was the advisor to this mass media thing last year. This year, the president of the IPS has once again given me chairpersonship of the school psychiatry and counseling thing. They believe that I'm really good with kids. Yeah. Today is a terrific topic, and I am so happy that Dr. Ghosh is going to be speaking on it. Adoption is a very big thing. We are seeing more and more people adopting, even though the queues are very, very long. I'm sure most of us have had patients coming to us where after adoption, they found that things were not as hunky-dory as they wanted, or they were not as romanticized as they've read about. I have been appalled at times when I've actually had one fairly well-known couple who actually wanted to give back a girl that they had adopted because they couldn't cope with her tantrums. So things like that now are becoming more and more commonplace. And hopefully with the dictum that every child who's single and doesn't have parents deserves to be in a family, hopefully our government easing formalities of adoption, which doesn't seem to be happening right now, but hopefully will happen. We'd look at this phenomenon happening much more than what is happening today. When we're talking of neurodevelopmental issues, the thing that really gets at us is that very often we don't know the past of the kids. So we don't know anything about trauma. We don't know how much they've been neglected. We don't know whether the parents were subject to using substances. We don't know their genetic predispositions. So frankly, we're just kind of looking in the dark. We don't really know what is happening. And it's so very important for us to have a better idea so that then we can be more effective as therapists or psychiatrists or whatever else you might call ourselves. I'm so glad that we are doing this because it is a very important topic. It's becoming more and more commonplace, and we need to know the latest about it. So welcome, Dr. Ghosh, and we hope you do, and we have no doubt that you do great justice to this topic. Over to you, Dr. Ruksheda.
Thank you, Dr. Chavda. IABP takes pride in curating interesting topics, but also seeing to it that the chairpersons are also very, very aptly associated with that particular session. So we know that Dr. Chavda has such a huge amount of experience in child psychiatry, in family psychiatry in that sense. So nobody better than him to help us navigate through this session today. And it is a pleasure to introduce the speaker today because, frankly speaking, the entire credit for the topic today goes to her, because I was talking to her about it. I was like, oh, what do you want to talk about? Do you want to talk about this? Do you want to talk about that? And she's the one who came up with this topic, and I literally jumped on it because we were like, oh, you know what? We've never done this, and I don't remember even attending a session on something like this. So it is entirely to her credit. And when I tell you a little bit more about her, you'll realize that clearly she's the one, the mastermind behind today's session. So Dr. Sreyoshi Ghosh is a psychiatrist. She's done her DM in child and adolescent psychiatrist from none other than NIMHANS. She's also been the AP at NIMHANS for 3 years, and she's gladly taken a partial kind of like a break from her career because she also is a very, very dedicated and new and a very happy mom. She also is in private practice right now in various places in Bangalore, and she's excellent in what she does. And, because she's a child psychiatrist, that she's so dedicated because she's kind of equipped herself with clinical skills, with not just counseling in regular, but also relational counseling and family counseling with a Gestalt background and all of that, so that we know that she is definitely passionate about what she does. And nothing like a passionate speaker to really bring home the topic and highlight all the things that the lesser, lesser knowledgeable people that we can all benefit from. So for no further ado, I'm going to welcome Dr. Sreyoshi Ghosh, and please, honor us with your presentation. And I'm sure that we'll be very, very benefited by all of this. Sreyoshi.
Thank you so much, Ruksheda ma'am and Kersi sir. I'm quite overwhelmed by that introduction. You had asked me for 2 lines of introduction, but it's so kind of you to welcome me in this way. I'll just take a moment to share my slides. I hope there's no trouble there.
So while Sreyoshi is doing that, our admins have very nicely reminded us that IABP does have a YouTube channel where the open access series is available. So anybody who's missed a session or wants to rewatch a session and relearn something can very easily go out to the YouTube channel and have a view. And it's an open access, so you don't need to be an IABP member to learn more about biological psychiatry. Yes, Sreyoshi.
Are the slides visible?
The slides are visible. You just need to start the slideshow.
Yeah, okay. I'm just going to minimize that panel because there's some content in the slide that occupies the whole screen.
No, we can only see your current slide. So I don't think you need to do anything.
Okay. And could you let me please know when I have about 5 minutes to go, because I can't see the time on my screen after having maximized the screen. Thank you. Yeah, perfect. I'm so honored and delighted to be here at this first Friday CME organized by IABP. And I'm actually doing a talk like this after quite some time. I don't take up, too many commitments like these. But when Ruksheda ma'am asked, I could not say no. So these are my contact details in case any of you would like to reach out, and I would love it if you do so. The topic for today is neurodevelopmental challenges in adopted children, and this is the overview of my topic. So, after a brief introduction, I just want to dwell very briefly on the impact of early childhood adversity. So, essentially, what might happen if there is very cumulative stress that builds up in children, right? So, when kids are adopted, there would have been an early period where they may have experienced trauma, the pre-adoption trauma. But what would happen if that sort of continued, right? So very briefly on that. Then to move on to what are the sort of disorders that we have seen in adoptees? What does research tell us? Then a little bit on specific areas of neurodevelopmental challenge. So looking a little bit at the neurophysiological aspects like evoked response potentials, a little bit about how they perform on various neuropsychological tasks. So discrete areas, not really the whole disorders. Then a word on differential plasticity, which is a very interesting concept that I read up more about during the period of preparation for this talk. Some research that I found from India, and then a brief bit about interventions, but there's not too much on that. So I'd like to tell you all about why I wanted to talk about this particular topic. I hope this is visible to all of you. So these are basically all the children whom I'm currently seeing right now. I had put their initials earlier, but then I removed those. So you can basically just see the sex, the age, whether they have a diagnosis of ADHD or not. And as you can see, all of them have a diagnosis of ADHD. Several of them, actually all of them, have one or the other psychiatric comorbidity. Anxiety in quite a few, and affective disorders, so dysthymia, depression in the others. Several of them have in fact benefited from medication. So I have quite a few on methylphenidate, one on atomoxetine. Another thing that is common to all of these kids is the fact that their parental mental health is not absolutely okay. So there are issues. I've written anger issues in the father because some of these issues have not exactly been typed. So we don't know exactly whether all of the parents fit into one particular box or not. But overall, like very high maternal anxiety, quite a bit of anger discontrol in the father. Some of them have both maternal and paternal anxiety. Parental discord in several. Most of them are also in psychotherapy and have been helped by psychotherapy. disturbed parent-child relationships in all of them. And this has translated even into difficult clinician-child relationships. So a couple of these kids I'm seeing for psychotherapy, others I'm seeing them for medication management. So it has been difficult to establish rapport with some of them. In others, I feel I see residue of more like the disinhibited social engagement pattern. They overshare, they really love to talk. And there's one kid who has not yet met me at all. Her mother's been trying, but she's very upset, very irritable, and she hasn't met me. So when I started noticing that there are these patterns in children that I'm seeing, and this is a current cohort, there's a group of children whom I saw while I was at NIMHANS where they were actually more severely dysregulated and severely disturbed than this particular cohort. But then I kind of wanted to read more about why are there these commonalities and what does the literature really tell us about all of this. My slide is frozen. 1 second. Yeah. So very quickly about the impact of early childhood adversity. So many of the kids who are later adopted, they would have at least experienced some of the early adversity at the prenatal, that is at the fetal stage, and also in early childhood. And what we can see is that these certainly leave a developmental impact. They would certainly affect certain catecholamine signaling systems. They would have a wide range of cognitive, emotional, and behavioral outcomes. And what is really to be seen is whether in childhood, adolescence, middle and late adolescence, whether somehow, to what extent can the impact of some of these factors be ameliorated by parents and by clinicians so that the final outcome on children is really not as negative as it otherwise would have been. So this slide and the next slide, this is from the CVEDA study, which is a really big study. It's NIMHANS is one center. This slide I would give credit to Dr. Isha, who was my colleague at NIMHANS. Basically, again, where they've looked at how cumulative stress can predict externalizing behavior. And in this particular slide, what you can see is that they have been able to divide children with externalizing problems into 3 groups. One is the green, where they've had largely overwhelmingly positive experiences. The group in the middle, which has been more tending towards a high load of risk factors. And the group to the extreme right, where it's kind of been a mix. So there has been some adversity. So if you can see right in the middle, you have low binary score of adversity. So which is the load of adversity. Although and also, the parental, there would have been low positive parenting. There would have been low positive experiences in childhood, but with some green factors, like in school, a lot of support and acceptance. What has happened is that the final outcome is in fact green, so they've done better. Moving on to what are really the neurodevelopmental disorders that we see in adoptees, what does research tell us? So there have been studies that have been going on right from the 1960s, which do establish that adopted children were overrepresented in outpatient settings, and they tended to be referred for externalizing behaviors. This is something that I have seen. This is something that the research has been telling us, and so linked to externalizing symptoms in adolescence, there's just been more offending, more substance abuse, and also together with that, development of some internalizing problems as well, unhappy, anxious behaviors, and the increased risk of suicide during adolescence. What these studies do demonstrate is that adoption for a minority of children does appear to be a risk factor. But I would like to stress that this is only when adopted children are compared to the general population. But if we compare them to children who have been returned to their families of origin and in whom the cumulative stress continues, like in the way that it has been studied in the Syeda study, compared to them, definitely adoption is clearly beneficial. So this particular individual, Van Ijzendoorn, he has been really involved in a lot of these studies related to adoption and adopted children. So in his meta-analysis project, the adoption meta-analysis project, AMAP, they've actually looked at differences, outcome differences between adopted and non-adopted individuals, which has revealed higher levels of externalizing and internalizing behaviors among adoptees as compared to non-adopted controls. And among international adoptees, those who have experienced extreme deprivation showed more serious externalizing behaviors than those who had not experienced such deprivation. However, what this meta-analysis also found is that the effect sizes for these patterns are small, and which supports the notion that early experiences, negative experiences or adversities prior to adoption, they do confer risk for some, but not for all children. There was one study done by Lindblad, which he actually looked at the national health statistics in Sweden, and he compared use of medication prescribed for ADHD in cohorts of adopted children versus non-adopted, and he found that the rates of prescribed medications were clearly higher for adopted children as compared to non-adoptees, and that a late age of adoption increased the risk for attentional problems. This was a study done in 2017, where in addition to looking at parental quality and ADHD symptoms, they also did a measure of cortisol assay. And what they found is that post-institutionalized children, they had more peer problems and ADHD symptoms in keeping with the previous studies that I've quoted, as compared to children who had never been adopted, with children who were in foster care in between these two groups. And both the children who were not growing up with their biological parents were at significantly greater risk of hypocortisolism, which is blunted cortisol diurnal rhythm and reactivity that can happen after a prolonged period of high stress reactivity. Now, no study related to adoption children can be complete without a mention of the Romanian adoptees. This is Michael Rutter had done a lot of work with regards to the Romanian adoptees, in addition to, of course, all the other work that he has done. And essentially what had happened is that in Romania, during this QSQ regime, there were several orphanages and children growing up in these orphanages who had experienced conditions of severe deprivation, very, very extreme early global deprivation. And so after they were adopted into American and European families, there were a lot of studies done on them. And what this showed, and this was these were very landmark studies, which looked at the age of adoption. And what they saw is that children who were adopted after 6 months of age, they exhibited a lot of problems in language and cognition several years later, as compared to those children who had been adopted younger than 6 months. And they in fact found, this was a different author who tried to look at what was the constellation of symptoms that were persisting into adolescence. And like we've seen, there have been ADHD symptoms, quasi-autistic features, and disinhibited attachment. And those children exposed to longer periods of deprivation were more delayed. Those placed at an older age appear to recover less completely. And even for those placed at younger ages, the most extensive recovery took place in the first 2 years. So now looking at specific areas of neurodevelopmental challenge. So there have been studies on structural brain development, and what they have revealed is that there have been changes in cortical volume, especially in the prefrontal cortex, with significant reductions in volume in those who have been post-institutionalized and then adopted, as compared to those who have never been institutionalized. And this has also been shown in a difference in hippocampal volumes, which has also been associated with duration of institutional care. with later adopted children who had the maximum exposure to adversity, showing the smallest volumes relative to non-adopted controls. Then again, the timing of intervention. So after there was one study looking at, how does the timing of intervention affect? So a lot of people also wanted to explore different parameters and how the timing of intervention might affect them. So this was where this particular study found that there were in fact consequences of removing infants from institutions and placing them into foster care interventions on brain electrical activity. And the intervention was successful for increasing the high frequency EEG alpha power, higher frequency, like for example, the alpha, right? Whereas those children who remained in institutions and for whom there was no protective intervention like foster care, their EEG bands remained largely in the theta band, which is essentially more slow wave. And that is something that we see in children with ADHD also, where that alpha theta ratio is altered, which has been a target of intervention for interventions like neurofeedback. Language learning. So this is one area that is again very, very strongly affected by age of adoption. So children who have been placed in families by 15 months. So we don't exactly know which exactly are the critical periods for different, these different areas, but roughly it is all of these are acquired between that age of 0 to 2. So in case of language, those who are placed by 15 months, they scored similarly to community controls on school age language outcomes at 8 years. Whereas children who have been placed beyond 25 months, so beyond the age of 2.5, they continue to show deficits in school language outcomes. Executive functioning certainly is another measure. It's been very extensively studied and clearly been found to be affected by early deprivation in institutional care. So, and these skills actually contribute to a wide range of competencies, including inhibiting inappropriate responses to strangers, which is what we see in disseminated social engagement, attentional regulation, turn-taking, emotional regulation, and many aspects of academic performance. And these are also skills that emerge early in life and they are sustained for many years, even after removing them to enriching and supportive environments. Furthermore, as we know, they're transdiagnostic indicators of risk. So they can form a critical step in the developmental cascade that in some children, and I'm emphasizing again that it's not that all children will have negative outcomes, but in some kids, it can lead to a cascade from neurocognitive deficits immediately post-adoption, which is reflective of pre-adoption conditions, to then later problems with peers, to academic problems, and then later on to internalizing issues and affective disorders. Now, for those parents, who have had a relatively easy transition as adoptive parents, so early childhood, middle childhood has been relatively easy, they should also be aware that it is possible that some of these effects on early brain development may manifest much later, and they may emerge only by adolescence many years after adoption. And there are studies now that are showing this. So a study by Van Teeghem in 2021 did tell us that children who had been adopted within the first 3 years of life, they did not show reductions in hippocampal and amygdala volumes until adolescence. And that reduction in adolescence was predicted by dysregulation of stress physiology, which, like for example, the cortisol physiology, which had been evidenced many years earlier. So far, I think perhaps the picture that I'm painting, although I'm emphasizing that it's a few children, some children, a minority of children, but the bulk of research seems to suggest that children are more at risk, there are more externalizing problems, and that adoptive parents are going to be up for a difficult time. That's where I kind of want to now look at, can we view it through a slightly different way? For example, through a strength-based lens, a salutogenic approach, and look at differential plasticity. So where I was introduced to the salutogenic approach is when I'd done a training by Dr. Robert Roten. When I'd asked him, that what is your understanding for why there are so many children who have been adopted, who have externalizing problems and behavioral problems. And what he said is, well, their brains are primed for survival, right? They need to be quick thinkers. They need to be vigilant. They need to be active. They're not, that's how they have been primed prenatally and perinatally. So they come into the world, expecting that they need to be able to ward off threats, expecting that they need to, respond quickly, not really expecting to be thrust into later academic environments and, have to do a lot of sustained attention tasks. And even in the cohort that I had pointed out to right in the beginning, my own cohort of children, I have found that many of them have extraordinary strength. So there are kids who are fantastic cricketers, fantastic horse riders, extremely good at music. So it is not really all doom and gloom at all. So essentially, what this concept of differential plasticity tells us is that there are domains that are more and less impaired in adopted children. For example, cognition and attachment are more affected than self-esteem. And we can see this differential plasticity even within domains. So even within growth, what we have seen is, although weight, height, and head circumference have all been affected negatively at the time of adoption, height and weight recovered completely following adoption, but head circumference, which is of course indicative of brain volume, did not. And even when it comes to neurophysiological indicators, what the BIEP, the Bucharest Early Intervention Project, does tell us is that there is a difference in the performance on neurophysiological tasks, like the go-no-go task, in children who have been previously institutionalized and those who have not been. So for certain aspects, like the latency for go trials, so this task is essentially one where if you see a go button, you have to press it. If you see no go, then you have to prevent yourself from pressing that button. So for the latency, the groups were absolutely similar. So the sort of the reaction time is absolutely similar. So adopted kids compared to neurotypical kids, they are very quick off the mark. So in a race, they will have no problem getting started. But however, when it comes to the amplitude and no-go trials, so high amplitude in a no-go trial essentially means that this individual has to exercise their prefrontal cortex more intensely as compared to those who have a less amplitude. So for these tasks, they were comparable to those who had remained institutionalized and those essentially who had continued to suffer from adversity. So indicating that their response inhibition is the area that is differentially impaired. Then even in neuroanatomical data, there is a differential plasticity. So what they have found is that the hippocampal volume has often recovered from early atrophy, whereas the amygdala has continued to be affected, fear responsive, stress responsive, and abnormally large. So what we're seeing is that two elements from the same zone, that is the limbic system, present differential plasticity and recovery following adversity, which means, and this is also corroborated by research where parents of children have said that who are adopted have said that their children continue to be very emotionally reactive, like for several years after adoption. However, when it comes to certain cognitive functions related to memory and then IQ, a lot of those have in fact recovered. So when it comes to neuropsychological tests, again, there are differences in groups. So there have been differences in sustained attention, impulse control, and spatial working memory or prefrontal functions, again related to ADHD symptoms, but not so much in problem solving involving spatial planning. Here, those who have been adopted after institutionalization, they have the same abilities as those who have never been adopted. So like I mentioned earlier, when it comes to IQ, what the meta-analytic evidence shows us is that adopted children's IQs rebound, and they can typically come within normal ranges within a year or so of adoption, and maybe as much as 20 points higher than the IQ of peers left behind in institutional care. However, even though the IQ is highly predictive of school performance, the performance of adoptees often lags, again because of this differential plasticity. And this is probably, these learning issues that they face is probably in connection with increased behavioral issues and also some executive function deficits. There are also differential plasticity in attachment systems. So basically, when relationships with primary caregivers are altered significantly by abuse or institutionalization, children do have attachment difficulties, both in attachment behaviors and also in attachment representations. Now, what the research tells us is, and we know that, of course, the attachment system is not set irreversibly during early relationships. It can be restructured when circumstances change. And what we have seen is that attachment behaviors, especially, can improve. So, for example, proximity seeking, reaching out to parents when distressed. These sort of behaviors can improve, especially when parents have characteristics that enhance attachment security, such as attachment sensitivity. So, if they respond promptly to distress, if they are emotionally available for their child, if they're able to read the cues that the child is presenting them with, and if they themselves have a secure, autonomous state of mind, which in the adult attachment interviews is basically reflective of a secure attachment relationship in childhood. I've just put this, image as kind of a break between all of the text-heavy slides, but also to remind us how important those early years and early months are when it comes to the formation of attachment. And also, we know that it is through a secure attachment that many of the other functions develop, like emotional regulation, and indeed, so much of the stimulation and the cognitive function. So, and this is probably why also that they have observed that there's such a difference between children adopted before 6 months and after 6 months, because after 6 months there's more of a definite attachment to a particular primary caregiver that would have developed. So then it is much more traumatizing for children to then have to adjust to this disruption in caretaking environment, and then that of course takes time, and it's after they settle down that they can then start to acquire new skills. So this is just to again let us know the importance of looking at the time of adoption. And so, like I mentioned before, the attachment behaviors often improve, but attachment representations, which is basically elicited through attachment interviews, where we try to look at how does the child perceive or understand attachment, how do they talk about attachment and about their attachment relationships. Those issues can linger. So there might be disorganization in how they perceive themselves in relation to others, how they talk about it. And even in adolescents, when they have done this work, they have found that 61% of adopted children had insecure attachment representations as compared to 39% who had secure attachment representations. And the children who were adopted late, they were more resistant to change at the representational rather than at the behavioral level. And of course, this can turn out into a vicious cycle. So where there is a child who has developed internal negative working models about themselves and about their caregivers, that they are unlovable, that caregivers are unsafe and unreliable, and of course, they may not have a very good vocabulary, for being able to express their emotions and being able to really tap into them, because that also develops in the context of a secure attachment relationship. So then we have conduct issues developing. We have parents treating them negatively and trying to discipline them harshly, which just can turn into a very vicious cycle. And so, in summary, to this whole issue of differential plasticity, what is possibly common to the developmental domains presenting greater resistance to change following improvement in caregiving conditions is their differential complexity. So the domains that are more complex, they are more resistant to change, is what this is saying. So there's a greater complexity of brain growth as compared to height and weight, hence the lag in head circumference. There's a greater complexity of certain neural circuits which require the combined action of various brain structures. And these could be responsible for tasks that require distributed brain activity, such as selective attention or impulse control, which are more resistant to change even post-adoption. And also the greater complexity of attachment representations, that must reflect relational experiences that are contradictory and difficult to integrate. So they had a certain experience prior to adoption. Now they have a different experience. So understanding and integrating these in the form of coherent attachment representations is much harder to do as opposed to the change in attachment behaviors, which are seen more readily. Very quickly about plasticity genes. So there is, of course, the long nature versus nurture debate. And the research I've been pointing to so far does, of course, point to a higher role of nurture. I've been focusing more on the caretaking environment, caregiving environment, attachment relationships. But how does genetics really play into all of this? And what we are now finding is that there are certain genes that code for differential susceptibility. So some certain genes which increase sensitivity to the environment, resulting in greater impairment under adverse developmental conditions, but in fact greater positive functioning when the developmental conditions are supportive. And some of these genes like the DRD4, the serotonin receptor transporter allele, and the BDNF VAL66 MET polymorphism have been proposed to be plasticity genes. And specifically in the context of adopted children, so in one study of previously institutionalized children, examining the BDNF VAL66 MET polymorphism, children with one or more copies of the minor allele, they showed more sensitivity to the age of adoption, performing better than other children when adopted early and worse than other children when adopted later. So this is something really remarkable because what it is showing us is that this particular plasticity in terms of the genetic makeup is extremely sensitive to the nurture that will come. And in fact, certain children can do extremely well, even better than children who have never experienced early adversity if they have some of these polymorphisms. Very quickly about some studies from India. So essentially, I haven't found any remarkable differences. There haven't been a whole lot of studies, but this is one that was done, and they essentially did see that there were a higher instance of behavioral problems in adopted children as compared to those who were not adopted. And IQ of children in both groups was comparable. Parenting practices also between those adopted and non-adopted were not really very different. This was this was a study about adoption disclosure and the behavioral adjustment of domestic adoptees, which basically indicated that social disclosure, which is disclosing adoption not just to the child, but also to other people in society. And they've quantified this and qualified it by looking at to what extent parents had introduced their children to other children who are adopted, had reached out to adoption networks. There are some of these organizations that are operating in Bangalore as well. And so what they found is this kind of social disclosure, stronger parent-child relationships, and the self-esteem of adopted parents, that had significantly predicted fewer behavioral problems in children. A very brief word about interventions. So the post-adoption environment does, as we know, they play a very critical role in recovery. And the factors that are most important are what is the family environment like? How stable is the family environment? A parenting approach encouraging age-expected behaviors. So parents who don't expect very much, right? Who don't have very high expectations, but have age-expected, expect age-related behaviors. A parental secure state of mind regarding attachment, and warm and sensitive parent-child relationships. And this would predict better developmental outcomes across domains. And the benefits of this positive family environment goes beyond the initial years, which, and even in adolescence, there is, again, a very critical role for the positive family environment, which can really make a big difference in whether the child will manifest behavioral and emotional issues or not.
Dr. Ghosh, 5 minutes more.
Yes, thank you. I'm about to wind up. I think this is the last couple of slides. Now, there have been a lot of interventions, mainly in the early childhood period, interventions designed to increase sensitive parenting. And they have, in fact, been shown not only to increase secure attachment relationships, but as a result of that, also reduce behavioral problems. And this has actually been reflected even in other domains. So when the caregiving environment has been stable, then even the height, weight, brain electrical activity, all of that has shown to improve. This is an intervention that has been carried out for vulnerable families. It's called the Attachment and Biobehavioral Catch-up Intervention, the ABC intervention. This has certain steps. So first, parents are taught to provide nurturance even when children are avoidant or resistant. Because young children who have experienced interpersonal trauma, they often push parents' care and support away. So how do parents provide nurturance even when the child is temperamentally perhaps seeming a bit difficult? And secondly, how do parents work on their own issues so that they can respond with support and nurturance? This is like basically wearing your own oxygen masks first. Parental mental health. How do they really process some of their own traumas, some of their own mental health issues? Thirdly, they work on the attunement. So parents are taught to pay close attention to children's signals and needs and respond in calm and empathetic ways. And finally, parents are coached on how to enhance children's self-regulation abilities because traumatized children, as we know, are often behaviorally and biologically dysregulated. And this is well supported by research to help children develop secure attachment and improved behavioral and biological regulation and fewer problematic behaviors compared to children in control interventions. So to conclude, for some adopted children, the process may contribute to or be associated with emotional and behavioral problems and psychiatric disorders. And children at particular risk include those adopted later in life, after early adverse experiences, as well as those at particular genetic risk. However, for most of the babies and children of all ages who find permanent families through this process, adoption does have a positive outcome and it does contribute to positive psychological adjustment and is clearly protective. So I've come to the end of my talk. Thank you so much for listening, and we can open the forum now for questions and discussion.
Thank you, Dr. Ghosh. Dr. Chavda.
So, Dr. Jyoti has asked, is there any difference in the child coming to know about adoption earlier versus later?
Jyoti ma'am, so currently what the recommendation is that the fact of adoption should be disclosed to children as early as possible, starting from preschool years. But it should not be like a one-time process where it's just told to the child that that you're adopted, but starting with using developmentally appropriate language when children are quite young to talk to them about it, and then of course later as they grow older to explore their perceptions of it. And adolescence is a particularly important time when a lot of kids do re-examine some of these notions about self and identity in the context of being adopted. With regards to the research, I haven't looked too much at whether adoption disclosure has affected neurodevelopmental outcomes. The study from India, where I had looked, which spoke about social disclosure, they had actually, that particular study had found that there was not much of an effect on whether the parents had disclosed or not disclosed on the neurodevelopmental outcomes. But the limitations of that study were that the sample size was relatively small. I think they had less than 100 children. And also, they were not able to really compare because many of the parents had, in fact, not disclosed. And this was from a rural area in India. So that's what.
As a corollary to that question, Dr. Sabrina is asking, when and how should parents disclose adoption status to their children who are adopted in infancy? It's almost similar, but is there a how to this? Is there a how to this?
There are some stories that have actually been designed. So I had worked with Dr. Kersi Chavda at NIMHANS, he's really an expert when it comes to children in difficult circumstances. He's worked a lot with JJ functionaries. And so there's a website called NIMHANS Child Project where they have a whole series on adoption related stories which involve an animal. So there's a rabbit called Mimi because children respond more, when the main protagonist of stories are animals. And basically how to introduce, these ideas to a child. Starting from the pre-adoption, like even before the child is adopted, to start this process of counseling them and continue it even once they're with their adoptive families.
Dr. Prajakta Kulkarni is asking, as children placed to adoption have trauma, what are the chances that they will have personality disorders later in life?
I haven't specifically looked at incidents of personality disorders, so I can't come up with a number or a percentage off the top of my head.
Yeah. Dr. Sakshi is asking what has already been said, which is the best age to tell the child about his adoption. Is there a best age, Doc?
As early as possible is.
As early as possible. Okay. Dr. Purvi, are there studies on sensory processing disorder in adopted kids?
There are studies on sensory processing disorders. They are higher than children who have not been adopted. There are some there's some articles on children in whom sensory integration therapy has proved to be beneficial. This is one that also has been quoted by Bessel van der Kolk in his book, The Body Keeps the Score, where he talks about this 5-year-old who had come to his clinic, and she was just not able to engage with anyone, and she improved only after sensory integration therapy, and after they started out from there to sort of help her to get some of these sensory processing issues more regulated before things like language and all of that could really kick in.
Sakshi again is asking, are there any institutes or centers that help build parent-child relationships in case of adoption in Mumbai? Now, Mumbai, you won't know too much.
No.
Yeah. Dr. Sakshi, you'll have to ask somebody else. Yeah.
Institutes that are also now in Mumbai, that are also now helping foster care before the children can be placed in adoptive homes. And they do work as a team where there are social workers and sometimes even counselors. If we don't really have, as far as my knowledge is concerned, we don't have like a particular module or a particular kind of set for therapy as such. And most parents would, again, just like any other issue, have to avail resources from the private sector and maybe sometimes even from the government and BMC sectors. But no particular organization or NGO or something only dedicated to something like this. But yes, a lot of institutes doing a lot of very good work, and at least can give also references for that. So that's, that. And having said that, now that I'm speaking, I would also like to ask Dr. Ghosh, are there a lot of studies or, where there's a comparison between an adopted child versus single child household versus a child where there are other biological children or other adopted children as well? And if there are any highlighting or features you can reflect. We have 2 raised hands. We'll definitely go to them after my question.
So are you asking about sibling relationships or?
Any studies where if a child has been adopted, whether the child is a single child or whether the child has been adopted, where there are other naturally biological children as well, and sibling relationships could be like, what the outcome would be like, anything at all. Any particular studies that you might be aware of?
I've actually looked at some studies that look at sibling relationships, and of course, the outcomes have been better when siblings have been both adopted by the family, as opposed to where they have been separated. but whether there is any difference on whether the first child is biological or the second one is biological, as opposed to a family only with adopted children, I'm not able to comment on
Thank
that right now.
Hinduja, I think, would like to comment on facilities available in Mumbai, and then we'll go to Dr. Shazia Kausar.
And of course, I'd like to tell Sreyoshi, very good talk, very lucid and nice. It was very enjoyable. Thank you for that. And I think Kara is one thing that is available all over in the country. So they have people who work a lot. And in Mumbai, especially, there's Nilima Mehta, who's done a lot of work in adoption and has written books on it also. So she's the person who does a lot of work on that, at least in Mumbai.
Thank you so much, ma'am. Dr. Shazia?
Good evening, ma'am.
I have
Good
a
evening.
question, and it may not be relevant to India because it's not yet there, but I would expect that as things become a little open, abroad, you can have two men adopting somebody, you can have two women adopting a child. We haven't as yet had that here, excepting in one or two cases with a film star, etc. Any studies on how they would be? Or you haven't really looked it up because it's not relevant to India right now?
I haven't looked it up too much, but I don't think, I mean, I've glanced through, studies where LGBTQ couples have adopted, and I don't think there is, that is particularly a factor that affects outcome. It again boils down to the quality of, the attachment sensitivity and the security and stability of the family, and whether there's discord and those factors.
Okay. Thank you.
Dr. Shazia wanted to have a comment or a question.
Yes, ma'am. Am I audible?
Yes, we can hear you.
Yeah. Ma'am, thank you so much for choosing this topic, which is so seldom talked about. And I just wanted to know two things. I don't know about rest of the India, but in our community, and especially in this part of India, in Kashmir, I mean, there is often a practice that when there is a childless couple, say an infertile couple, they often adopt children of their relatives. Now, this might be a healthy practice. It might seem a healthy practice, but often such children get compared with the siblings that stay with the parents. So I just wanted to know if such practices are prevalent in rest of the India, or if there is any data pertaining to children who are adapted into the families of their relatives. Number two, I would like to know if there is any effect of gender on children, on the relationship of attachment that develops between children and the adopted parents, because we know that in our societies there is often a preference for male children. So often when there are many females, they are given away in adoption. Might not be true everywhere, but there are some families where such practices are prevalent. Also, I would like to know, are there any studies that have been done about about children being adopted into non-conventional families? Like nowadays we are having single parent families, and as someone said about earlier, also LGBT families, there again transgender couples adopting children. Are there any studies that are being done in such contexts? And if there is any data, whether there is some particular precautions or some different styles of parenting that need to be adopted for such children who are being raised in single parent with single parents. That's all I wanted to.
I hope Dr. Ghosh can remember all of them. So
my working memory is quite taxed. So the second question I can respond to the easiest, I think, which is how the sex of the child can impact. So the studies do show that if a child is male, there is a greater risk for adverse neurodevelopmental outcomes, and that's similar to how we see, even in non-adopted children, even in adopted children, that's a risk factor. I had actually read about adopting children of relatives, especially under Islamic law, because there was a senior colleague in our WhatsApp group
exactly
who had asked me to read up on it. I didn't get around to presenting it. I had specifically looked for whether the outcomes would differ from that which I've presented, but I was not able to find research. I specifically looked, but I was not able to find research that specifically points to whether children, Muslim children, who have been adopted from their relatives' families, and I've read up about the personal laws, some of it, which actually does say it is a little bit different. But I wasn't able to find outcome studies, and that seemed to me like a big gap in research.
Yes, ma'am.
Really,
That's exactly. There
like a
there is.
huge gap.
So
Um,
Majid and Shazia and all of them can take up that study. Sreyoshi, back to this question. I think recently, at least a couple of pre-COVID, there was a incident. There was a report that there were more girl children being adopted than boy children in India. So, do you have any other statistics? I know it's not in the purview of our talk today, but still.
mhm. No, exactly regarding statistics, the exact statistics I wouldn't be able to give you right away, but yeah, I completely agree that that has been the trend. Even in the children whom I'm seeing, and I'm thinking about it now, there are only 2 boys, and all the rest of them are girls. In fact,
Because I think
yeah.
that would be, interesting to look at that. Why is there a preference for adopting girls
Mm-hmm.
as a boy?
Absolutely.
And how does that also impact children who don't get adopted? And interesting. Dr.
Ma'am, excuse me. Is there a possibility that more of the girls are being given in adoption? We can look at it the other way around
There
also.
is a possibility.
No, when we're looking at between girls and boys, the more girl child are getting adopted than boys. It's not about that,
You
there are
mean from institutions?
adoption.
You mean from institutions, more of the girls are being picked up for adoption?
There are 100 children, 50 are boys and 50 are girls. So, more girl child gets adopted than boy child. So that was the statistics pre-COVID. Unfortunately, it's not a particular area of interest for mine. So I didn't, read up on the statistics there. Dr. Chavda, a number of questions in the chat.
So much.
Yeah, but Madam, is there any protocol? Pooja is asking, is there any protocol for the assessment for psychiatric disorders of couples or parents wanting to adopt?
I'm not aware of a separate protocol.
Okay. Preeti Arun has asked, many parents ask, what should be the age of the child to be adopted? As early as possible, I guess, isn't it?
Yes, but then there was another comment in the chat box saying that that the outcome for late adoption, a lot of the studies reflect to worse outcomes. But again, I want to stress that it may be slightly worse as compared to never adopted children, but it will still be better than children who are remaining in institutions. So if parents are ready to kind of work with clinicians, work with adoption agencies to support kids, then I don't want to say that there should be a prescribed age for adoption, because then the older kids are just kind of left in the lurch.
Vidyut Khandelwale says, most of the time parents expect the psychiatrist to disclose to the child. What should be our stand?
I don't disclose. If the disclosure is happening, it would be with the parents also in the room.
True.
Dr. Chavda, I think Dr. Alka Subramaniam has made many comments in the box. Dr. Alka, if you are there, can you make us wiser with your audio rather than messaging
on my? I can't. Yeah. Okay. I'm trying. Sreyoshi, very nice.
Hello, ma'am.
Very, very well presented.
Thank you. So glad you're here.
Yeah, I didn't want to miss this one. It was too compelling. So yeah, a lot of questions have come about adoption centers, processes, and so on and so forth. So just to jog back so that everyone knows, there's a very stringent protocol actually. CARA has made everything very streamlined. So if adoptions are happening through regular centers and through institutions which are registered under CARA, which is actually the only way one should adopt, and we should encourage our parents who are adopting to go through that, then the whole process is quite standardized. So they have standard modules for pre-adoption procedures. There is a social worker who is sent actually to the homes. There are financial disclosures which happen. The paperwork, in fact, takes so long that if the paperwork is not perfect, then the children are not given up for adoption to those parents who are looking to adopt, right? And yes, there is a gender skew because unfortunately still in our country, girls are given up more so for adoption than boys. And you would find girls given up at a much earlier age. So sometimes boys are given up, but then you find they are a little older. The biological parents would keep them for a little longer before they realize that it's not viable, and then they kind of give them up for adoption. And we used to have Family Welfare Center in Mumbai who used to do extensive work with adoptive families in terms of counseling, reaching out at different stages, and so on and so forth. But after the advent of CARA standardization, now there is a standard module for that too. And all the agencies which are doing the adoptive process have to not only do the pre-adoption formalities, they have to have an orientation program for the parents. Then you have the adoption process, you have the birth certificate to be given, the legal process, so on and so forth. And post-adoption also, there is a counseling session for the parents, and for up to 3 or 5 years. I'm not sure exactly how much it is now. We'll have to check on that. But it's definitely not less than 3 years. The adoptive parents have to keep sending reports to the center. Anshu, I think it has changed to 5 years, but we'll check on that again. Definitely not less than 3, that's for sure. And they have to send the reports to the center along with photographs and financial disclosures. So there has to be a certain amount of money earmarked for this kid by the adoptive parents, so that to ensure that the kid is safe, and the state has given responsibility to the parents in that period. The first 6 months is actually called as foster care. So they don't give the child legally till they are convinced that there is no abuse, there is no neglect, there is no nothing, etc., happening. So they're very clear about that part of the surveillance. Unfortunately, the regulation of the centers themselves and monitoring is not so stringent. So children who don't get adopted and are adopted much later, what happens there and what kind of care is taken is yet, that process of regulation is yet to happen more stringently. So most parents through word of mouth will know that these are the centers. If they are not adopting within the family, then they will know that these are the kind of centers where one should go, where there is less amount of neglect. This is what a lot of parents have given feedback to me too. And within family adoptions also nowadays, we always tell the parents, if you want to be on the safer side, it's better that you go through CARA. There is a possibility to do it. It takes a little longer, but it's safer to do it the legal way, because once the government or the courts come to know that things are not appropriate, then, they're they're not very merciful with those parents. They always question, why did you not do it the right way? And lastly, at any given point in time, the child can be monitored by the agency who has given it up for adoption. Also, if the child chooses to go on a hunt for the biological parents at a later date, the agency is supposed to keep the records, at least basic records, because the child has the right, once they are older, to actually look for that. The process of revealing, like Sreyoshi said, absolutely bang on. It is age appropriate. If the child asks, how was I born? So you were definitely born from someone's tummy, but it was not my tummy. Things like this. If the child continues asking, go ahead and answer. Otherwise, wait till the next question comes, which could be after 2 or 3 years. And all this process has a standardized module, which Kara has developed. So it's really interesting to go through that and kind of read it, right? And one of the very popular stories, of course, that's for Hindu mythology, but is Krishna, because Krishna was considered to be one of the first adopted official children, if I may say so, and very famous. Another popular way to sort of break the news to the child, if one may say so, is to have a pet. And how you say that you get used to having that pet, and the pet is now part of your family. Similarly, an analogy is that's how the process of adoption takes place. So, sorry, I had a lot to say. I didn't mean to really take away from what you did, but there was so many questions. So I thought I'll just share over the years whatever we have experienced. Thank you, Majid, for asking me to speak. And
I think Dr. Abrar was raising his hand, but I don't see his hand raised now. Maybe Alka's already covered all the answers.
Yeah, ma'am. Alka ma'am, really, thank you, Alka ma'am. Thank you, Sreyoshi ma'am, for such a nice topic. Alka ma'am really gave me the answers. But to coming to part that why more girls are given into adoption, if we see from the act like Muslim, the Property Inheritance Act, there is much to see into it. Like if the boys are given into the adoption, so it's like 2/4 or 1/3 of the property distribution that goes into it. While as in case of girls, like whole of the family, if the couple is childless or they are planning to adopt, they usually take the consent of the family, all of the family who are living with them. So how to go into it if it is from their relatives itself. So that process, in that process, it is seen. Like I work with a child guidance center here in Kashmir. So I see most of the cases that it's because of the relatives who live along with them and the properties that come into the scene. That is why more of the girls are being given into adoption from this part or the clinic that I sit in, where I see all those things. So that was the thing I wanted to add, and Alka ma'am really clarified all the doubts. Thank you, ma'am.
Thank you, Abrar. Dr. Chavda, are we okay?
I think so.
Should
1 minute. Dr. Jyoti Shetty has come up with the statement that some communities may not allow for adoption. Parents can only be guardians. Can this impact family dynamics and the child later?
Chavda sir, can she speak? I think she can come in and speak out. What exactly?
Sure. Dr. Jyoti, would you come in and put your question?
Yeah, thank you. So, as I was saying, in fact, I think some communities do not allow for adoption formally, but then the parents are, on paper guardians. I want to know whether this impacts family dynamics when later on in terms of the parents' interactions with the children, or is it something that, does not really matter?
Hi, ma'am. So, again, I had read up on this, and you're very right that I think Muslim, Christian, and I think Parsi communities, all of them, for a long time, they
Yes.
allowed only guardianship. And it was, in fact, a Muslim lady who had sort of put this matter before the Supreme Court, saying that, she's adopted a girl child, but, she doesn't want to just be her guardian. She wants to be her adoptive mother. And also for the child to have, inheritance rights, which was not there under the Guardianship Act. And and so, parents themselves were coming forward and saying that this is affecting, our dynamics, like, with our child. And also, this whole thing, I think someone else was also pointing to it about biological privilege. So, so why can't this child be my child? So after that, because of those issues, the Supreme Court actually has said that all communities, in fact, under the JJ Act, they can adopt, and the child can have all the privileges, or can be that parent's child in every sense, and that it doesn't just have to be limited to guardianship. So you're very right. There were dynamics that were affected, but currently, to the best of my knowledge, if somebody wants to adopt, they can still do that despite their personal laws by through the JJ Act, because that kind of covers all children regardless of community.
I can't see anybody else.
Yeah. Thank you so much. This has been a lucid presentation with an exuberating, unending discussion, which speaks how beautifully this got presented. I will be, with a warm and graceful evening. I am Dr. Junaid. I work as an associate professor in GMC Srinagar. At the onset, I would like to thank our speaker, Dr. Ghosh, who is who has been an assistant professor, and now she's a mother as well. And I can understand how taxing it would be for doing both the jobs so nicely. And I will also like to thank Dr. Ruksheda ma'am for taking time from her daily schedule, and your presence had really graced this occasion. And Dr. Kersi Chavda sir, another stalwart in child psychiatry, who has again, with your presence, this presentation after Dr. Ghosh, your words have really helped in getting us more knowledge and information about all these things. And I would like to thank and feeling privileged to all the people who have contributed and made this event such a wonderful success. And also this audience whose presence has already lived up to the expectation and has just made up how important this topic was. And at the end, I would like to thank Abdul Majid sir, who has given me an opportunity to give the vote of thanks. And I won't be taking much of your time. Happy weekend. And I think Majid sir has to say something about at the end.
No, I don't. I think vote of thanks, and that's it. And good night all. And we'll see you again next month with the First Friday CME series from IABP. Stay connected, stay in touch, and stay healthy and happy. And good night.
Cheers. Bye-bye. Thank you.
Bye. Good night. Thank you to everybody.